So, quick question. How do you differentiate between OCD and perfectionism? Let's look at these two key points in order to understand what sets them apart. Number 1. Why they do it. A perfectionist will have extreme standards for yourself or others, and will often get hung up over some minute detail. But these are personality traits that we all possess, only in perfectionists they are amplified. OCD, however, is a mental disorder, and people with OCD have repeating intrusive thoughts that are irrational and in most cases will lead them to perform repetitive behaviors in order to ease their anxiety. For example, if these two were washing hands, the perfectionist might wash them for a little longer than usual to make sure it is clean. But a person with OCD might be so anxious of germs on their hands that they wash their hands until they bleed. Number 2. Their effects. A perfectionist can become stressed out and anxious due to their tendency to strive for extremely high standards. But it can also sometimes lead to positive results. It just might take longer for them to complete something. OCD, on the other hand, is almost always destructive, as people repeat their compulsions to the point of not being able to do anything anymore, as they sometimes take a few hours just to check if they lock their doors. And this causes heavy disruption in their daily life.
As a side grad, it is sometimes annoying when my friends or relatives ask me if they have OCD, when in reality, they are either slightly over-concerned towards their performance or they have checked their lock a few more times compared to others. Wash their hands slightly longer than they usually do? You get the idea. The point of this video was not trying to make fun of those who don't know the differences between these two, but to highlight the fact that a lot of people trying to trivialize mental illness into something bland or something to be excited about. For me at least, this can lead to people exaggerating their everyday struggles, such as saying they are depressed when they are in fact just a little bit sad. For those who have them, mental illness is not a joke. And I think the first step to truly respect them is to learn, at the very least, how to differentiate between what we consider normal and what lies beyond our perceptions, but is as tangible to those who have it.